Derby Health and Wellbeing Board. It's nice to see so many people here. Lindsay, do we have any apologies, please?
We do. We have
Thank you. There are no light items. Do we have any declarations of interest? No, thank you. Do we all accept the minutes of the last minute meeting as a true record of the meeting? Yes, thank you. Anybody want to raise any matters from those minutes? Councillor Kerr. Sorry, Councillor Kerr, could you put your...
Sorry, I haven't got them open at this moment, but there was one point where it refers to young children when I think it ought to refer to young adults.
Do you know which page that would be, Councillor Kerr?
I've got it open now. Here we are. It's on page 3. The councillor highlighted that COVID-19 position where national statistics showed that a lot of young children were not in employment and training. So it's, second paragraph. Yeah.
Thank you for that correction, Councillor Kerr. And you happy with that? Yeah, could I ask you to turn your mic off, please? Can I just remind everyone, thanks, that A, if you don't put your mic on, I definitely won't be able to hear you. And secondly, please speak to the mic rather than turning round, because we are being live streamed, so it's so any potential watchers can hear you, but also everyone else in the chamber can hear you when you speak forward to the mic, although it may seem rude if you're talking to the person behind you. And thirdly, could I just remind everybody that when you stop speaking, can you turn the mic off, please? Otherwise, it suppresses the sound from other people's mics. All right, thank you very much for that. The next item we have is the Health and Wellbeing Board Action Plan. I've looked at that. It all seems to be in order. I can't see any particular points to raise. As far as I'm concerned, does anybody else have any points they want to raise about the action plan? No? Thank you very much. And so moving very quickly on then, I'm pleased to say that finally, after much anticipation and much interest, and we now have our important Derby poverty strategy to be presented to the board by Heather Greenan. Thank you, Heather.
Thanks very much, Chair. So yes, this is the culmination of about 18 months of work and engagement across the city and working in partnership to do so. The report presents the latest, I guess the kind of final draft of the poverty strategy, underpinned by an action plan and also equality impact assessment. I think as colleagues around the room are aware, we know that Derby has higher levels of inequalities than we would want. And certainly from a child and family poverty perspective, I know this board in particular has seen some really interesting presentations that really do shine a light on that. So work over the last 18 months has focused on trying to, I guess, build on some of the longer term interventions that we can put in place. Because I guess previously where we had focused on a cost of living perspective, we recognised that that was kind of short term in nature, kind of sticking plaster type solutions. And I think whilst this strategy focuses on the next 3 years, it is moving us more into that medium and longer term perspective. I suppose it builds on a wide range of research, both that we've done from an inequality perspective, the reflections that we had from the delivering the cost of living strategy. We have built in a wide range of engagement. In particular, we did some equality impact sessions last year, focused on the socio-economic duty with Fair Chance Derby, and much kind of broader partnership input. So, for example, in March, we took a lot of the insight to the City Partnership Board, who really did give their endorsement to tackling poverty together as a city. The strategy itself focuses on what we call the 4 Ps. And I know we have presented this to the board previously in terms of protecting, it's preventing, it's about creating pathways, and it's about promoting structural change through the likes of lobbying. And really those 4 pillars have enabled us to then develop specific actions that are focused around 5 different themes. So family and child poverty, improved and affordable housing, better skills, jobs and a growing economy, better health and better lives, and finally financial inclusion. And we feel that they are the 5 thematic areas that actually can bring together some consolidated action. There is some great work that is already going on, and I think in a lot of ways what the poverty strategy and the action plan brings together is really all of that work, because we know across all sectors there's actually some really good work. So the action plan partly reflects that, but I think also does focus on some of the gaps of areas where we can do more to tackle poverty. So we had an external review by Resolve Poverty, who have done a lot of great work with Greater Manchester, and we've used those reflections to help us develop the strategy and the action plan. We've also worked with a number of different offices across different partners, and we plan to basically consolidate that into a delivery group that will kind of lead on the overall action plan. It is intended to kind of again consolidate the governance around this, and the Place Partnership for Resilient Communities will actually own the document. So the stage that we're at the moment is to do a final round of engagement. So we have a communities-based session coming up in the next week or so to focus particularly on the equality impact assessment, understand where there's any further gaps in the action plan, probably also smarten up the action plan a little bit. I think there's probably opportunities to be a bit clear around what actions, what performance measures we include, and I completely recognise that. But in addition to this board, we will be going to the Poverty Commission next week, the Place Partnership, and really then it will work its way through to Cabinet in June, with the idea that we do a more formal launch over the summer. But obviously that is subject to comments that we receive from those different groups and different community members over the next few weeks. So it really is kind of culminating, hopefully, in something positive that we can all endorse and will make a difference in terms of how we approach and tackle poverty. I'm happy to take any questions. Thank you.
Thank you, Heather. And just before I bring in any comments and questions, and I hope there will be some useful input to this, I'd like to thank Heather for all the work she's done on this. She's shown excellent leadership from the very early days where she was just coming up. I don't know entirely off your own bat, we don't know, Heather, with some very innovative interventions that we could just do some sort of quick wins, forgive the phrase, in Derby, which were actually pretty effective, and not obviously tackling the structural causes of poverty, but actually pragmatically helping people either a bit more money in their pocket each week or some intervention that was going to give them an extra bit of advantage, and Heather was there doing that, just getting on with it. I know she's led this work and she's had various partners to deal with who've made various requests at various times, which are probably very valid, but they have delayed the work. And then in addition to that, you know, for people like myself who wanted to see the strategy in place, partly because I know people, even in my own ward, who are quite keen to get involved in some way and do what they can for others in the city. And there was this feeling that, well, we need a framework for action, which I think this strategy should give us that. So I've been pressing to say, well, can we get this out? And I know we've had to wait for the government to publish their own strategy. I mean, in the meantime, Heather hasn't stopped, and others also in the council and partnership haven't stopped doing the good work that they do. But we haven't really been able to... And actually here in the Health and Wellbeing Board, of course, I'm really proud that one of the only outside speaker as such, outside of our membership that we've had to speak to the board was... my insistence was we even paid for her train fare, which was exceptional, wasn't it, Alison? For somebody to come from the Child Poverty Action Group in London and address that issue for us from a very analytical and charity, but also they're very much a lobbying group, as everyone knows. And I'm really proud that subsequent to that meeting, although it wasn't causal, but I'm sure there's some correlation, the government did lift the two-child benefit limit, which will be a single measure which will take a lot of children out of poverty. And the reason that's of interest to us, because in the current health and wellbeing strategy, which was formed some years ago, before I was the chair of this body, that was actually one of the key strategic aims of the strategy, to focus on trying to reduce child poverty in Derby. So there's been a lot of concern, there's been a lot of alarm at times at the rising numbers of children in poverty in the city. It's certainly, despite, knowing about levels of inequality we have in Derby, it shocked me to see the rising numbers in recent years. So I will shut up, but I do feel quite strongly about this issue, and I'm really pleased that we've got this document. I've got a few points to make, Heather, but I will shut up and let others come in. So thank you to Heather and the team for this. Councillor Kerr.
I think this shows how much is already happening, and despite all the things that are already happening, how much more we still need to try and do. But the thing that strikes me most about this, I think, is how it's the individual people who are absolutely key to their own lives and the way their life develops. And I think that's why it's really important that this has had such a strong engagement with the people who are there at the sharp end and challenged. But the other side of this is that there are also people in the community who can give them the support. And there are some, there are formal arrangements talked about here within the community sector and how they will get involved in some of these activities. But there was also individual opportunities as well. And I think this might be an area that could be explored further, where people are doing a befriending role. And some of this will be covered by activity which the local area coordinators could facilitate. But some of it is other routes, such as the Shared Lives Plus, where somebody who has space in their house but also needs a bit of support could be matched with somebody who has the capacity to give support, who might also themselves be struggling, but bringing the two together, both will be supportive of each other. And I think that's not specifically mentioned, I couldn't find a reference to that in here, but I think it's something that we are already doing as a council and which could also feed into this sort of work. But there's also informal things, and I remember in the past there being things like adopted aunts, uncles and grandparents. But if there was that sort of facility, that may also be something that we could enable and could become a more way of engaging and supporting people within the community, which without the formality of having to belong to an organisation or to work to a particular schedule. So there's a lot here. There's a lot we're already doing, but I'm sure that there are still these further things we could do. And it's particularly this within the sort of very informal, supportive, almost the sort of COVID conscious of your neighbours supportiveness that could be included here as well. How we formalise it, how we bring it forward, how we encourage it, I'm not entirely sure, but maybe others have those views.
Thank you, Councillor Kerr. I mean, I know I'm going to maybe put Andy Smith on the spot in a minute, because obviously I think Andy Appiah would probably be the best person to answer this, but he's not here. Though I know that there is work in adult social care to sort of rework the shared life service at the moment. There are some public health officers coming in, Robin, aren't there, some managers to deal not exactly with what you're talking about, but sort of addressing that kind of area. So I think there is some anticipation and some recognition of the importance of the kind of initiatives you are referring to in terms of concretely helping individuals who are in very specific situations, particularly disabled people. I mean, I'll shut up. I don't know, Andy, if did you want to come in first, Heather? As it's your report, Heather, do you want to come in first?
Yeah, no, I mean, I'm absolutely right. There is more that we can do. And I think the work that Councillor Kerr's referring to is all about building community resilience. And actually, we're doing that in so many different ways across many different service areas. But, you know, we are very much trying to do that at a locality level. And I guess where we've tried to reflect that, I mean, there is a huge amount of work going in. What we've tried to reflect is through our prevention strategy. And I suppose coming at it from a council perspective, we have a demand insight and prevention board that is looking at how we do try and align our initiatives and really try and focus on individuals. So yeah, the other thing that, sorry, I was going to say that I should have said in my intro that I didn't, is that lived experience is a really critical element of this. And a big part of what we want to take forward is having, you know, a kind of a bit more systematic lived experience that I know comes through the likes of great groups like DHIP. And certainly it was something that we particularly got back in terms of Fair Chance Derby, in terms of, yes, all of these actions that you're doing are great, but do you know the impact and actually, you know, the lived experience of those who are experiencing it? And I do think that's a really important part of this as well. So I think we're addressing it in a couple of ways. But I do recognise, I mean, you know, from Councillor Kerr's perspective, that there is more we can do. And I hope that this will be a platform to us, you know, to enable us to take that forward. Thanks.
Thank you, Heather. As I've named them, and before I bring you in, Alex, I'm just going to give Andy, I don't know if you did have anything to say in response to what I've just said, Andy, about the shared lives or...
Can I make some broader points first? Because I was going
You can say whatever you... Sorry,
Okay.
I know, Alex, I will. As I brought you in, you certainly can, of course.
Thank you, Chair. I mean, just don't want to repeat what you said, Alison, but I think the engagement in this piece of work has been really impressive. And when you read the report and you read the action plan, you can see it's a really system-wide, city-wide approach to how we tackle poverty, and the impact of poverty is so clearly outlined, and those of us that work in the city see and feel it in lots of different ways in the work that we do and in the conversations that we have with people. I think there's a couple of pragmatic reflections I wanted to make, really. I think the plan is really impressively detailed in many ways. I think there's things in there that we are already doing, there's things in there that we want to do. And I think part of what Lucy was reflecting is around that focus on connectivity, on prevention, on relationships. And I think the plan is both very applied in many ways and very specific, but also quite strategic. And there's just something about how, I guess, Heather, the delivery group, tries to take that forward in a way that doesn't let things drop because of its ambition and because of the weight of what's in it. The test now is how we take that forward and obviously measuring the impact of that as we go along. I was interested, Heather, in the kind of interface with the wider government approach of tackling poverty and how that interfaces with what we're trying to do in our local Derby plan and how that's going to come together. And I suppose it's just the commitment we need to make here and beyond around being very clear about who's got particular leads, because there's a lot in here. There are still some gaps around who's going to do what. A lot of it, some of it connects with work we're already doing across different services in the broadest sense. It's just about connecting and making sure that people know what's in here and how we're going to do it, so that we don't just all say it's fantastic and then it ends up unravelling, which we can sometimes do, can't we?
Is that it, Andy? Okay, thank you very much. Thank you. Yeah, I can absolutely endorse that. And I've got a couple of points I want to make myself, which sort of follow on from what people have already said. But I'm going to refrain. And I'm going to bring in Alex now. Thank you.
Thank you, Chair. Alex Ball, Director of Strategic Partnerships at the Integrated Care Board. So just to, I guess, endorse what Andy said, I think the ambition that this shows is really impressive and should be commended, really. I think the understanding of the place and yeah, the scope and the scale of the action plan, I think, is really, really commendable. I'd just probably build one small thing in the action plan under the Better Skills, Good Jobs and Growing Economy section, which refers to local initiatives for job support. this is a really complex landscape. You know, every time you turn a corner, there's another scheme for supporting people in work and so on. But we are into the autumn going to be launching Work Well, a partnership between the Integrated Care Board and DWP. So good news, that's another programme. Bad news, it's another programme. So there is a job of work to be done. And City Council colleagues are already plugged into our discussions on this, but there's a job of work to be done to really help simplify and make that really accessible for residents. Work Well in particular is designed to intervene where people are sort of on the cusp of work, either just about to potentially fall out of work or just need a little bit of support to get into work, particularly because of low-level health needs. And it really feels to me there's an opportunity there to quickly act and identify the right people so they don't kind of slip into that longer period of worklessness, which, as we know, can become incredibly sort of self-reinforcing. So, yeah, just, I guess, a plug and a plea that we can hopefully include that as one of the bullet points in that area to work together and support that rollout and help our residents to navigate what is quite a complicated landscape to find the right support for them.
Yes, thank you. And just before I will let Heather come back. I just compelled to make a point myself. I think you've just raised a really, really important point that we have discussed certainly in the agenda meetings, haven't we, Alison, and with the previous ICB Vice Chair. This is a really important area of health, the relationship with work, and I'm really glad that initiative is happening. We have talked about probably having someone from the DWP as a membership of this board. We've looked at that, and given to just very quickly in relation to the need to develop and endorse neighbourhood health plans and the much anticipated demise of the ICPs, we are thinking about how we can expand the Health and Wellbeing Board to be that place where we have the partnership discussions. I know they happen elsewhere as well, but to enhance this Health and Wellbeing Board appropriately, and I still think we might want to go back to the DWP and say, do you want to be part of it? Because it is a really important part of health. But Heather, did you want to respond to that?
Yeah, just to say thank you. It's an excellent suggestion. Very happy to incorporate. Thank you.
Just before I bring you in, Councillor Ashby, Robin, I just gestured to you earlier. Do you want to come in, Robin, or are you happy not?
No, I'm quite happy. I can pick up with the next item.
Okay, thank you. Councillor Ashby.
Thank you. I just wanted firstly to say thank you to Heather. It's an excellent report, and having sat, as Councillor Martin has spoken of, through various reports over the years, it's really good to see the way that you're taking this structural approach to tackling the wider determinants of health. My one big concern in reading all of this is, housing is such an important factor, and that's where my biggest concern is how, when we look at the 8,500 families on the housing waiting list and stuff like that, and we know the shortage of affordable homes in the city, that's where my huge concern lies as to how much of this can make a real impact on the lives of the people who are suffering at the cutting edge of all of this. But I'm really delighted that the whole strategy has been used working with the people with the real life experiences at the cutting edge of poverty. So thank you. And thank you for the action plan with all of the detail of who's going to be responsible for pushing each part forward and the time frames, because that makes it real for those of us who are not deeply involved in it. So thank you so much.
Thank you, Councillor Ashby. Yeah, you do really raise a really important point about housing. Obviously, there's no quick fixes, I suppose, to some of the... This is a strategy, isn't it? So, in a sense, it needs to articulate what the key problems are and how they could potentially be addressed with some key actions. But obviously, some of these problems are entrenched and hard to address. But Karen... And we'll be answering the point on housing.
It was just to say, if the board feel it would be beneficial, we certainly can bring a report outlining what is being done at the moment with regards to housing and how the strategy is incorporated predominantly into the new build, where we can look at the space standards, energy efficiency, but even with the acquisitions and refurbs, obviously energy efficiency is one of the things that we do look at that. So I'm more than happy to do that if we want to table that and the board feel that that would be beneficial.
Well, I personally would be very interested in that, please, Karen. I don't know if other people on the board, yes, thank you, getting some nods. I'd really welcome that, Karen. I mean, as a cabinet member, I've been aware for a while that I don't feel I'm quite on top of where we're at with particularly social housing, which is probably my fault. I may have missed a briefing. So I would really welcome something here on that. And I know that we can't build 8,500 homes if it were to be that number overnight, but it would be reassuring to know what we are doing. So thank you for that. So we could put that on the plan. Yes, sorry, I can't. Is it Lucy? Yeah, thank you.
Hi, Lucy Allen from DCHS. I think as well, just to commend Heather on pulling this report together, it's an unenviable job but probably a very rewarding job of pulling it all together. I guess more of a pragmatic point I was considering was there's a lot to get done in 3 years, and actually has there been any consideration for how we'll prioritise the actions for impact on poverty? And also, I think when you look at the aims, I know Heather, you'd said about making these a bit smarter in terms of the actions. I was just thinking about, have we got baseline measures for some of these things already, and can we measure them? So, because they're quite broad aims of the strategy. So, and then I think my final point was just, I think it mentioned in the paper that it will link to the health and wellbeing strategy. So it was just that point of connection there between the overall strategy as well.
Those are really good points. Thank you, Lucy. I mean, I would stress as the chair that this is a strategy. It's not the act. I mean, I know there's a lot of planned work in here, Heather, but it's the strategy, not every point of the plan. But I think you raised a really good point. Do you want to come back on that point?
Thank you. All great points. I mean, I suppose there is a lot in here, but what I would say is that there is a lot already underway. So for me, it's about prioritising potentially the new areas. Certainly, what I hope is that this is all funded as well, because that is a key element. It needs to be resourced. I certainly in terms of actions that have been put in here, they are resourced. But again, we potentially some of these actions will lead to other things that maybe aren't resourced that actually we do need to think about. In terms of the action plan and pinning down the measures of success, I absolutely agree. And if I'm honest, we just haven't quite had time to do that. But that is something that I'm certainly hoping to do over the next couple of weeks, really, just to do that. If I can just make perhaps a couple of final comments, if that's okay.
Well, I do haven't actually.
Oh, sorry. In which case, I will let you do that.
So you've got those excitements to come, but so it won't quite be the final point. But carry.
No, that's fine. I just, given the fact there's health colleagues in the room, we did go to the Place partnership, where there was primary care networks and other health colleagues around the room, which was really useful. And I am particularly keen to just make sure that we do join up with, I think, work that is going on, and I think there were opportunities identified about how we could perhaps tap into GP networks, because GPs do play a really critical role. They often will see some of the key people that we need to target. So that was something that I think also we perhaps just need to develop. The other aspect was just to say that if I can just commend the work of Jenny Wizard, Paul Brookhouse, and the likes of Danny Rutter and many other people on the Poverty Action Group. This isn't just me, so please, I do not want to take credit for this has been a proper team effort, and also the Poverty Commission as well, who have championed this agenda over the last few years. So thank you.
Thank you, Heather. So I just have a couple of points. One is perhaps more straightforward and to answer, and not very controversial, which I think that I have read the report. I would want to go back to see some of the actions in more detail, but from what I saw of the actions, I wondered if there could be potentially a bit more action focused specifically around people with disabilities. That's just a thought. There may be stuff in there that I haven't been able to pick out as such. My other point is perhaps more diffuse and some people wouldn't agree with it, but I think it's about how you structure, how and what way you frame the interventions and what your focus is in terms, because clearly there's scope in here to intervene with families, with individuals and with certain areas. And I would, I imagine that is I was sort of asking if there is that approach. And when we're looking at areas, I would just ask for an element of caution, because there is a focus in here on wards as an area of focus. But we know that, the wards basically are political entities, aren't they, defined by numbers of electors. So I just ask to have some caution as to whether that, in terms of areas of the city, whether focusing on specific wards is the best approach as a ward. If, for example, if you take the money that's just come through for the government for Derby South, the place in partnership, is it the special place money, that is actually in an area which they've identified through these areas of multiple deprivation as being a very, very, very entrenched poor areas, which we know is true in that area, but actually bits of it in Blagreve Ward, bits is in Normanton, bits are in Arboretum. So I think this sort of sense of identifying the area through the political ward could be limited. And another reason I asked for that, I'm not saying it's entirely invalid, because of course, there is a generality of the area, but I think the risk of that as well, particularly if we are absolutely glued to focusing on the most deprived, which I've expressed to this meetings and in other forums before, I think is not a political strategy that I recognise as being particularly a Labour strategy, but I know we're not trying to talk politics here, but also I think it just ends up compounding poverty, and I've made this argument before. But I think that we are actually going to miss areas. So, for example, and I don't want to go on about my own ward, but I will use it as it's a really good example. And I don't often talk about my ward in this way, but we have the West End, which is very, very highly deprived area. It's one of the highest deprived areas. It's the biggest area. It's where the estate is. And it's not tiny, but it's a defined. But obviously, in the stat, if you look at the last set of stats I had for which show multiple deprivation areas in those smaller areas of units, then Darley Ward came out above Blagreve Ward and Abbey Ward as having more of those than those wards, and also about halfway down the list. If you average it out as a ward, then of course Darley goes up the list, because we are the most mixed ward in the city. So I'm not necessarily making a plug for my own ward, but I can tell you that there are very, very few interventions, apart from our meetings as councillors, that happen in the West End. There are very few groups working there with people. It's very, very unseen. And I suppose, and it isn't, people know it's traditionally been a poor area of the city, so it's not like nobody's ever heard of it. So, and there's that, and there'll be places like that in Mackworth. And these are areas of really entrenched poverty with zero social mobility, etc. So I suppose that's already my request, that we do look at those smaller units. I asked you earlier, for different reasons, I asked you to send me some stats of that earlier on, but that was for a completely different purpose. But I'm just asking that we give it that nuance, otherwise we're going to miss quite significant areas of the city where we've got a lot of entrenched poverty. Thank you.
Yeah, thank you. I think whilst we do often use wards to compare, for example, deprivation and other outcomes. If I can perhaps just reassure yourself and the wider board that I think the approach we're taking is much more nuanced. So if I can just give an example around financial inclusion, we are using the policy and practice, it's called the LIFT tool, so it's Low Income Family Tracker tool. What that does do is look at a number of factors where, identifies particular cohorts at risk, and that's at household level. So that is, we're not just using, quite high-level ward data to really target those people. That is just not feasible. And I know across different service areas that, again, we're drilling down into more complex information. So, for example, if I look at supporting families, again, there is a tool that actually helps us, pinpoint households in a different way, because that is for me the best way forward, where we're using our kind of evidence that we have, because it's multifactorial in terms of things that are impacting and triggering poverty and other I suppose different elements that we're seeing. So if I can just reassure you, I think it is much more nuanced than just using some ward data. Yeah.
That's great. Thank you, Heather. And I am reassured by that, thanks. And I appreciate that it does mean, there's all kind of levels at coming at this, and they're all valid, aren't they? And that's a huge task, and it is a huge task. And obviously, there's a lot that, I'm glad you mentioned lobbying, because of course, we know that there are macroeconomic factors in this that are very important. It's not just, we can't resolve this entirely as a city as alone. So there's all sorts of layers. So I'm glad have got that, Nuas. I'm reassured by what you're saying. And I look forward to, if there are no other compelling points, I really look forward, because I noticed you say you're going to report annually. So, before you know it, we've always struggling to get the reports on the agenda, aren't we? But obviously, assuming I'm the chair next year, which is obviously going to be decided in a few weeks' time, whether I'm the chair or not. But then I shall certainly really look forward to an update. But my goodness, it'll be coming around sooner. Before you know it, won't you be trying to write the next report? Okay, so if we're finished on that one, thank you. I'll move on. Thank you for that, Heather. It's really exciting stuff and important stuff. And I'll move on to Robin, who's going to present to us. Robin Dewis, Director of Public Health, is going to present to us Derby's, this Health and Wellbeing Board's draft Health and Wellbeing Strategy. Thank you.
Thank you. Do you want to move on to the next slide, Lindsay? Yeah, lovely, thank you. So we've had a number of conversations around the development of this strategy, and obviously we do have an existing strategy in place, but this is the work that we've undertaken to update and redevelop that. And part of that work has been looking at all of the other strategies that we have in place, and importantly the poverty strategy being part of that consideration. We did come with a position statement some time ago that the Health and Wellbeing Board agreed, and from that we've been also taking forward work with a stakeholder group, looking at the local data, having a think about what works, and really importantly, since we started this development work, that ambition that we have actually to become a marmot place, and the work that we've been engaging with initially with the Institute of Health Equity as well. So it's come a long way, I think, since we started this work. So what we've got now is very much a draft, and the draft is in the documentation for everyone to have a look at. I'm going to have a run through some key points, and very happy to have feedback today, but also very happy if we can say over the next 2 weeks, if anybody wishes to give me any feedback by email as well, that would be incredibly useful. So we do love a plan on a page, and we do have a plan on a page for the strategy, so just summarising the key points. But if you want to go to the next slide, Linz, I'm just going to run through some of those areas. So the aim of the strategy is really to bring us all together, to have a shared vision, to establish our strategic priorities, to understand how we're going to work together, to really define how we're going to make a difference. And some of the feedback that we've had about the previous strategy was how do we know that we've made a difference with that? So we need to be much clearer with our measures. And also as part of that, how we will deliver, which needs to be something that we consider perhaps later as well in the neighbourhood health conversation. So the vision is that Derby will be a city where people and communities can thrive with fair access to the building blocks of health, and where inequalities in health and wellbeing are reduced. And the building blocks of health is terminology used by the Health Foundation that just really helpfully explores and describes those aspects of our lives that we need in order to be given a fair opportunity to have good health. And just to say, this is where the poverty strategy fits really nicely in because poverty is a key issue within those building blocks of health. So the next slide, thanks. So we know, as was mentioned, we've got a really significant variation in health outcomes between our communities. We usually, and I'm sure it is the case at the moment, have the greatest difference between our most deprived and our least deprived populations in terms of life expectancy for the East Midlands. And some of our health indicators are the worst in the worst nationally as well. So there's a huge amount of work to do. And we know that those inequalities are greatest where multiple disadvantage overlaps. So poverty, disability, as you mentioned, Councillor Martin, and then other aspects of our lives as well. Where we see those aspects interfacing, we know that those individuals struggle the most to obtain good health. And what we need is a coordinated system action because we know that none of us can tackle this on our own. Thanks, Linz. So the strategic priorities have been developed through that stakeholder group and also through the evidence and the data. And as we've got there, so we're running through 1 to 5, looking at strengthening the building blocks of health. So the first part of that, I think, is building the understanding around the building blocks of health and ensuring that we have actions around them so that people are living in safe, warm homes, healthy surroundings, and have access to healthy and affordable food and are more active. Those really fundamental things in our lives. The second one is around information and support and services. And this is about promoting equality and ease of access to all of our programmes, particularly prevention programmes. And we know that immunisation and screening are some of the key areas that we think about and consider within this board. The next one is around accessible and joined-up health and care services, and those services being inclusive and culturally appropriate. So ensuring that the way those services are delivered is also inclusive and allows people to access them. Fourth is reducing health inequalities by proportionately focusing effort based on need, and this is always around that idea of proportionate universalism and focusing our efforts in relation to where the need is. And then the fifth one is strengthening communities and co-production. So making sure that through all of this work, we're building trust and we're supporting our community networks and continuing to build services that people can identify with and that they feel meet their needs. So next slide, please, Linz. So there's just a few slides running through some of these areas. I won't dwell on each of them, but just to pick out some of those areas, as mentioned, around the building blocks of health. We're thinking about housing, education and skills, food, the environment and green spaces, transport and social connections. So all of those broader aspects of our lives that are really key to enabling us to access good health. Thinking about information, support and services. So this includes removing barriers and ensuring, as I mentioned, access to early help and prevention. Next one, thanks. For the accessible and joined-up health and care services, again, we are really focused on prevention and early intervention, but as mentioned, delivering these in partnership with communities. Next one, thanks. Reducing health inequalities, again, we think about co-production, we think about relationships, we think about trust. And then if we just go on to number 5, and we just had a reflection that our actions around number 4 and number 5 actually look really, really similar. So this is around strengthening communities and co-production. So this may be some of the learning for our draft, actually, that we may have repeated ourselves here. But again, just an emphasis on the key aspects of co-production and trust within the engagement with these services. So around how we will work differently and thinking about this as a system and a place. So focusing on prevention, thinking about our communities, and ensuring that we're coordinated and we share the accountability for the outcomes of the strategy. The strategy doesn't belong to one organisation, it belongs to the board and to the partners within the board. We will be data and insight led, and we need to think about that final one, which is the capacity and resilience, both within the services and within our population as well. So the Health and Wellbeing Board will be providing the overall leadership for the strategy. And as mentioned, we're going to be working with the Institute of Health Equity to develop Derby as a Marmot place. And we just have a little summary of the Marmot principles at the end for those who aren't familiar with them. But the Health and Wellbeing Board will be absolutely key in the development and delivery of that. We must be a whole system, we must be place-based, and we must have communities central to the work that we do. And again, this is a strategy, so underneath it will lie those action plans which we'll be reviewing and updating regularly, and importantly, measuring how we're performing against them. I think we've probably, just other than we will be using a live course approach, I think that's the key thing to pick out from that we probably haven't mentioned before. And the next slide, thanks. So it's important as we follow this strategy that we're thinking about both the outcomes we're achieving and the process measures. And this is the development that we need to do around measuring our impact. Yes, we want to have an impact on healthy life expectancy, but we need to be measuring something more tangible in the short term to ensure that we can achieve that in the longer term. And we will ensure that we are measuring an impact on inequality within those measures, not just looking at overall performance for the city. I think that relates then to, as you mentioned, Councillor Martin, around averaging over a ward, averaging over a city, you can miss some of those key areas. So the next slide,
It's
thanks.
very better articulated than I articulated it, wasn't it? Definitely.
So the next step, so currently we have a draft strategy and we're really keen to engage and to refine and finalise this strategy. So really keen, as I said, over the next couple of weeks to have your feedback on any areas, any issues that where you feel we're missing something or needs amendment. And then from this work, we need to move on to develop the detailed action plans, to conduct those equalities impact assessments on the work that we're doing, and to consider from those actions how we're going to develop the monitoring framework. And then finally, it's around communication and engagement with our population and also with our stakeholders as well. So this is going to need the support from the board in order to do this. Thanks, Linz. So we have a closing statement for the strategy, just identifying that this is a shared commitment, that we're all in agreement to take this forward, that it's about long-term evidence-based and community-informed action, and that we're committing to work together through it because we know that we can't achieve this on our own. And the next slide, Linz. And here's just a summary for those not familiar with the Marmot principles. So these are the principles that we'll be investigating later in the year with the Institute of Health Equity. And you can see them now, just run down them. So the first one is around every children having the best start. Next is about maximising capabilities and control for our population. Next is about fair employment and good work. Next, a healthy standard of living for all, which is where the poverty strategy fits in nicely. Create and develop healthy and sustainable places. Strengthen the role and the impact of ill health prevention. Tackle racism, discrimination and their outcomes. And pursue environmental sustainability and health equity together. So I'm sure you'll agree there's nothing much to disagree with within those principles. And during the work that we're doing with them, we will be refining particularly which areas we're going to be focusing on in our work in Derby. Thank you. I think, is that the last slide, Linz? Yeah. Thank you. So there's some questions really for the board, firstly around supporting the strategy, willingness to go through and to send any comments through to me, but then also support for developing the action plans and taking this forward, because we will need some shared capacity to do that. Thank you.
Thank you, Robin. Thank you for noting the recommendations, which I apologise, Heather, I forgot to reference the recommendations in your report, but I think we probably just signed up to them wholeheartedly anyway, so thank you. I think this is a very comprehensive strategy. It is a strategy, so some of it's high level and some of it's sort of very much what you would want to achieve, and the problem is how do you achieve it. But it is a strategy, and I think it's really excellent and comprehensive and captures where we need to be as a city. So I thank you for bringing it, but I will take comments, obviously, on it from Amjad.
Thank you. Just a quick comment. Just want to say thank you to Robin and the team, particularly the stakeholder group. The role the community connectors played in this has been instrumental. So it's not just data-led, it's real lived experience-led. And we've just got to ensure that community connectors play an integral role in the implementation of this strategy as well. So thank you.
Thank you, Amjad. And I think, yes, that's the thing, isn't it? I mean, we are not a delivery board, the Health and Wellbeing Board. So in a sense, we are limited, but in a sense, our role is going to become more important with this new health framework that we've got. And one of the things I've talked about briefly with Alison, and this, in terms of what happens at the board, which I know is a discursive domain, that's what we are, yeah, that's it. But is perhaps, and this may not be an idea that people like, so it may not going to happen, or it may not be hard. It might be hard to make it work. But we could be an idea of having sessions where we take one outcome, and we invite partners to contribute how they are working towards that outcome, rather than having one body talk about it and everybody agree that that's a good idea. But because what that means is the way we're currently working is that. For example, the fire service, we have excellent attendance from the fire service, and I know you're doing excellent work, but we very often don't get a report from you because you're the way you fit into the board. And I'm not just picking on you, there's lots of other people in the room, and I think you'd be doing stuff that does contribute through the work you do to some of our broader aims in specific areas. So that's an idea that we could work on in terms of trying to focus on some of the outcomes, what everybody's doing, and less collective ownership rather than it just being one person's engagement. So we'll perhaps come back to that. Claire, thank
There we go, sorry. Thank you, Chair. Claire Raybould, I'm one of the Executive Directors at the Integrated Care Board. This is a really strong, well-developed strategy, actually. Really welcome it. And can recognise all the work that have gone into it. We've just in the ICB published in March actually at our board a new population health strategy, and it's completely aligned with this, so that's really, really positive. I think there's, particularly with the emerging neighbourhood framework, and I know we're going to talk about that later, from an opportunity, I think there's probably just something for us to think about the architecture. We'll need to have proper oversight of this and delivery, given the neighbourhood paper that we'll talk about later, and happy to support some work on that. One of my directors, Tom, who I think you know, Robin, if I can link him in with you, because he hasn't had the opportunity to have a look, and I recognise you're dealing with a lot of new faces, but I'm sure he'd be very happy to support. So just very, very supportive. It's absolutely the right direction of travel, so thank you.
Thank you. Sue-Ann?
Thank you, Chair. I also welcome the strategy, and since it came for review a few months ago, Children's Services have felt really engaged in the iteration that we've got in front of us. And I think a sort of a way forward, I agree, in terms of how do we manageably feed back all on the outcomes. And I think everybody on this board chairs a representative board or committee, and I'm just thinking for myself in terms of Families First. This is very much part of the wider discussion around what Families First is trying to achieve along with the poverty strategy. So I see that sitting alongside this, alongside the outcomes for Families First. So it could be that underneath this board there'll be chairs within this group and committees and other boards that then could feed back how they are within their partnership achieving the outcomes. But I really welcome this. It's really helpful. Thank you.
Yeah, thank you for that proposal, Sue-Ann, and that could be a very good way of working as we anticipate the much anticipated but yet to happen demise of the ICP. I think that might be even more worthwhile. But thank you. There's something we need to think about. We're not assuming that everybody has to contribute to everything. It's just an idea of shaking us out of one person taking the lead when, if we're buying into the strategy, obviously not everybody can do something about everything, but we all need to own the strategy and have elements to it. Alec, would you mind turning, or Councillor Ashby, would you mind turning that mic off for me, please? Thanks.
It's broken. It's stuck on.
Is it stuck?
Yeah, we try to do that at the start, but it's broken.
Okay, thank you. So I'm not obsessed with the mics. It's just that I notice what I can't hear. Quietly spoken person, I can't hear with the mics on. Robin, did you want to come back on?
I think that's a really good suggestion. I think we can come through as we look at the actions. And I was just remembering back when we first began the Health and Wellbeing Board meetings, we had a group that sat below called the Coordination Group, didn't we? Which feels like the chairs of some of those meetings. So we probably need to have a think through how we work it. Yeah, thank you.
Thank you. Yeah, and as Amjad said, how we can also, if we're serious about co-production, how that connects with others as well across all the communities in Derby. Yeah, thank you. Any other comments for Robin?
Yeah, just briefly, I mean, I really agree with Suan's excellent point about how do you try and map the network of meetings, boards, groups that sit across the system that will be contributing to the strategy once the plan's developed, because it's not about creating a whole new beast, it's about trying to tie things together, and there could be some real added value in that. It'll take a bit of thinking, and we're not very good as a system sometimes at putting the jigsaw together, are we, and trying to streamline and make sense of things, but there's a real opportunity there. And I suppose the other thing, which is more a strategic, reflective point rather than something for us to get into discourse about now, obviously this covers 26 to 31, and just thinking about the LGR impact in relation to our strategy going forward as we start to understand over the coming months what the footprint will look like across Derbyshire, and then what does that mean as we start to think about our communities and the population that we'll be serving in what will probably be a larger area in the south of the county that will include the city council. So that's going to be something we'll have to, I guess, build in flexibly as we go forward, which I think can be done, but it's just something to factor in, isn't it, from the off, which I know you've got on your slides, Robin, because that's all we're talking about at the moment, it feels like, isn't it? Thank you.
Any other comments, reflections on this? I'm just, all I see now is mics across the room that are on. And I think yours stuck on as well. Yeah, I know. So I'm not guilty. It's just right, not true. Right, if there are no other comments, I'd like to thank Robin and everybody who's contributed to this work to developing a new strategy. As Andy said, there is a question of where the councils are heading and how it might integrate with other, but we'll deal with that when it arises. And I'd just like to thank everybody for their input, and thanks, Robin. That's a really excellent report today. Thank you. And I think, have we covered all the recommendations in our conversation? Have we covered them all? I think we have. Yeah, thank you.
I think so, yeah.
Right, and the next item is the Better Care Fund submission. Gamal, thank you.
Yes, thank you, Chair. Gamal Nizar, Director for Commissioning. And Chair, the report outlines our joint work with the ICB and the Council in terms of our Better Care Fund return for 26-27. Key points in the report and the documentation, quite a lot of narrative we have to return, of course, to NHSE England. The BCF remains one of the government's national vehicles for driving health and social care integrations, and the requirements for the policy are published by the Department for Health and Social Care and Ministry for Housing, Communities and Local Government. The Better Care Fund guidance sets out expectations of how ICBs and local authorities will work together to agree the expenditure plan with partners, and there is a joint BCF commissioning programme board underpinning the Better Care Fund. 4.8 in the report outlines the number of national conditions that must be satisfied for BCF plans to be assured by the Department for Health and Social Care. And those three key conditions are around effectively supporting the delivery and integrated and preventative care, comply with the grant conditions, and effective governance and reporting and engagement within that. In terms of financial context, the report sets that out. The overall value of the Better Care Fund is 44 million, and 7.1 in the report sets out the breakdown of the various elements that come together to bring that pool budget of £44 million together. And Chair, there's detailed narrative that we submit as part of this return that's been developed jointly between ourselves and colleagues from the ICB. And Chair, in summary, the detailed report and expenditure of that 44 million is all around adult social care, integration, reablement and hospital discharge, and together with sort of care packages and contributions towards care packages, local area coordination, reablement is a key factor, demographic pressures within that. So it's quite a comprehensive, detailed information that we have to submit. But in summary, this is our return for 26-27, similar to 25-26, meeting the new guidance documentation, and those elements of the 44 million are set out within the narrative return. So Chair, can I present that in the recommendations for our joint submission for 26-27.
Thank you, Gamal. I just remind the Health and Wellbeing Board that approving the Better Care Fund submission is one of our few actually statutory defined duties as a board, and therefore can I refer everybody to page 1 on item 8, the Better Care Fund update, and the recommendations 2.1 to 2.5, which I'm not inclined to read out, but essentially it's approving the spend and objectives, it's noting the revisions, to note the narrative, to approve the draft planning template for expenditure plan and the narrative plan, and to delegate to the Chair of the Health and Wellbeing Board, as been agreed for a few years now, in consultation with the Strategic Director for People Services, the final planning template and the narrative plan, and any minor amendments to the report. So before I ask you whether you are happy to approve recommendations 2.1 to 2.5, do we have any comments, please, on this report? Thank you. So I'd like to thank Gamal and everyone involved in this. I know this is another huge piece of work. It's extremely important expenditure, and it's very important work with the ICB. It doesn't sort of excite in the same way that some of our other paper reports probably do, but it is our fundamental, one of our key statutory duties, and it's really important work. So I'd like to thank you for that work, Gamal, and everyone who's been involved with it. So therefore, I'll have a quick show of hands then for everybody who does support the recommendations 2.1 to 2.5. Thank you. That's those recommendations are carried, Gamal. Thank you very much. Okay, so now we will move on back to Robin Jewis, and this time with Alex Ball on the Neighbourhood Health Framework.
Thank you. I'm just going to say a few words at the beginning, just really to reflect on our conversation that we had last time around the development of the Neighbourhood Health Framework and plans. And just to say we left the conversation last time at the point which was we weren't going to take anything forward until we saw some of the national guidance, and that has now been published. So we can come back to it now, and particularly just have a think in relation to the health and wellbeing strategy conversation as well, around the resources need to do this, and then also the expected role of the Health and Wellbeing Board. There's some areas in here which aren't necessarily a function of the Health and Wellbeing Board currently, So just really some reflection on that as we think about it. But I'm going to hand over to Alex.
Thank you, Robin. Thank you, Chair. So yeah, I'll just highlight a few bits, I think, to hopefully help flesh out some of that discussion that we'll have. So if I can just point people to paragraph 4.4 in the report, that I think helpfully the framework really kind of sets out those 5 main aims of neighbourhood health. And I do think it's important that we keep that kind of fairly clearly locked in our minds, that it is quite an expansive policy agenda in terms of what the government is trying to achieve here. So I think that's helpful that we have now got that clarity, having previously been guessing or hoping or thinking about what the guidance says, and now having that set out, I think is useful. It is worth noting, however, that in the immediate future, the asks as set out in paragraph 4.5 are probably a little bit narrower, whilst that goal 1 kind of probably has that big picture piece. There then are a considerable number of quite core, probably NHS kind of ambitions or goals or targets within there. What I'd really encourage the board to think about is think about that as an and conversation rather than an or a because or an instead conversation. There are some things that certainly NHS colleagues will have to focus on and deliver in the near term. That's been really clearly set out. The opportunity here is to do that at the same time as using this new neighbourhood health service and the whole framework to deliver on our wider ambitions as well. It's a busy old world and there's lots to do, so I think it's important that we think about that as an and opportunity. Paragraph 4.6, I'd probably also just call people's attention to. Really clear that the centrality that the Chair mentioned a moment ago of health and wellbeing boards, I think, is starting to come into sharper focus. I'm almost excited as you now, Chair, for when the legislation might actually be published for the abolition of integrated care partnerships. But as and when that does happen, and we really do understand exactly what that landscape means, and perhaps the health and wellbeing boards coming into place in their stead, then I think there is a real kind of opportunity for us to think about this group and how we want to maximise that opportunity. And then I'll just, final couple of points, just whiz colleagues down to section 4.14 and the 4th bullet point in there, which tasks ICBs and health and wellbeing boards to agree those neighbourhood footprints around natural communities for the future development. And again, we've had quite a helpful discussion, I think, here today around when averages can sort of smudge out inequalities within the boundaries that we choose to draw for ourselves. I have to say, I think, as someone who's gets very excited about maps, I'm probably the least helpful person to have in the room if we're thinking about this. But the framing here around natural communities, I think, is what really needs to guide us. We will, I think, and perhaps council colleagues more than NHS colleagues, will cleave to our existing boundaries, our existing wards and so on. Where they aren't natural communities, it does feel like we've got both permission and an expectation that we think about those perhaps a bit differently. And then, probably the final thing that I think this guidance helps us to move towards is, and again, we've touched on this at various points, start to think about our governance arrangements. Yes, the Health and Wellbeing Board, but our place partnerships, other kind of executive groups or groups that sit in and around existing bodies. This probably gives us an opportunity to think, have we got those right? What do we need to do to set ourselves up for the future? So that's probably everything I wanted to say. I'll hand back to you, Robin, and see if there's anything else.
Thank you. So, and I think just to pull out that, so for the Derby City Place Partnership has been seen as quite fundamental in both in developing our health and wellbeing strategy, but also in considering how we deliver against that strategy. And I think it's a very live conversation, isn't it, Alex, around what the future of those partnerships is going to look like. And I think we'd be really keen to keep something there that has a city footprint that brings those people together. But yeah, I'd be interested, Alex, whether there's any steer from the ICB around their thoughts for that at the minute.
Happy to do that now, Chair. Yeah, I mean, and Claire will probably want to come in as well. We definitely don't have a definitive position on that at the moment. What we are clear on is that we will want to think about, again, those natural communities and finding the right way to come together. We are, as a cluster of ICBs, stretched across quite a geography at the moment and going forward. So we will have to be proportionate and agile, and we're probably going to have to be involved in fewer forums than we have been up until now. And we're also acutely conscious that we're still pending the outcome of local government reorganisation. So that, as a statement of the sort of fairly obvious, there's an awful lot of moving parts at the moment. We could probably do with some of them settling down a bit. But I think, Claire, we're clear that there needs to be a piece of work done relatively rapidly when we've got some of those bits of information to make that final call.
Yeah, just to add, if I may, Chair. So, from an NHS perspective, we've just recently had a kind of system executive meeting to talk about what we need to do in this year, because, as Alex said, there's some things that we've got to do. So we're just working on the current footprints that we're working to, which people will be aware of. But we're acutely aware of what we've got to do going forward, so that there'll come a point where we're going to have to look at that. But I think the architecture that we've got currently isn't quite right either. And obviously, if the ICP does disappear as we expect, then we certainly need to look at that. But we've got no firm thoughts. I'm very happy to work with colleagues in the local authority, particularly and the rest of the NHS, about how we do that.
Thank you. I'm aware from a national meeting I was in this morning, that some places have conflated, if you like, the health and wellbeing boards and the place partnerships. Now, I don't know if that makes any sense whatsoever, but I know that's what some places have done. So that's just a point. I think I have to come back, Alex, on this point about natural communities, though. I'm not sure who created that phrase. Do you know? I mean,
yeah, that's in the national. That's not in the national guidance.
It's an interesting one, isn't it?
Yeah.
I mean, I think it's like an oxymoron, really. I mean, community is a socio-political kind of entity, political with a small p, by definition. So therefore, it's not necessarily natural at all. But I guess what they're driving at. But I have to say, in terms of that intensity of people's sense of where their belonging is and where it's not, I don't know if you've ever been involved in a boundary commission review, but my God, it's the kind of point at which you get closest to sometimes when people are getting that wrong. It's where you're getting close to kind of local insurrection in our country. You know, it's something, I mean, forget some things that cause revolutions in other countries, but this causes so much trouble, you know, along with things like, you know, potentially depriving people of tea or something. You know, it's at that kind of level of feeling. So I think it's a good ambition, and actually I think it kind of connects. I wouldn't personally use that terminology whatsoever, because I think it's, well, I think it's a meaningless term, but I appreciate what it's driving at. And I think in a way it probably relates to partly what I was saying earlier on. You know, let's think about, let's not get totally attached to a sort of a ward, which, although I would say that boundary commissions do take people through a lot of processes where there's a lot of fighting. If people think they're being split off from people they connect with, sociologically, if you like, not necessarily politically with big politics, they don't like it, and big, you know, and they let that be known. So I think that's a complex one, but there's obviously loads of work to do here. Did anybody want to come in on this? Councillor Kerr.
I really welcome this way of looking at things, because when the communities work best when they have the services they need local to where people are. And this is doing it for the health bit of our services. And I think you're right, that there is going to need to be some review of where the architecture is, where the actual buildings are in some parts. And I'm also mindful that we need closer working between this level of service delivery and our local plans, which are looking at the way in which the area is developing in terms of its new housing estates and its new various new developments. Because we've had the problem in a number of places where there's been the concept of, for example, a new GP surgery going in, but then we haven't got the delivery of that for that community. And this seems to me to be establishing the priority that should be being given to ensure that we have got the right physical architecture to be able to service the communities that are existing. And if we're going to do that in the future, we need to be smarter at making sure that the planning system is actually able to deliver, with its relevant groupings, what we need for that community. It isn't just in health that we need this. There are other things. You know, obviously, schools is a big one, but you know, basic things like shops need to be there. Other services like I don't know, children's nursery or the elements that actually make communities work. And going back to the initial discussion about poverty, if you can't get to the services you need, that is one of the reasons why you aren't functioning. So this way of thinking, it's brilliant that the NHS is picking this up and doing something about it now. But as a wider health and wellbeing board, I think we need to be mindful that it isn't just health that needs to be providing services in the right places. There are other things too.
Thank you, Councillor Kerr. I think you've made some really excellent points there. I think you're absolutely right. I mean, for the ICB there, you have to think also about specific health services, don't you? And I think there's clearly you do, because that's what people expect you to deliver, and there's a lot of money going into the system to deliver that. So you're absolutely right, Councillor Kerr. But I do think, I mean, just very quickly before I bring in Andy, that I think that these the 4.5 goals, immediate goals or something, they're very, very, very valid. And I think what we will focus on, the broader determinants of health, I think for many people, that whole point of actual health and health, the psychological understanding of being reassured about your own health and well-being would be massively improved if we could improve access to general practice. I think it would be, that is the thing that most people want most of the time, and I know you know that, but I think it's worth saying and recognising, and it's good that it's there, as well as those other goals, because in terms of offering health services, that is what people want, and it's good that it's there, in my opinion. So thank you for that, Councillor Kerr. Andy.
Yeah, thanks, Chair, and I really agree with Lucy's reflections there. There's just something for me in terms of taking this forward about how, as a system, do we ensure from a national health perspective, ICB perspective, NHSE perspective, that the 5 aims are achieved as part of developing neighbourhood health as outlined in 4.5, but I'm really struck by paragraph 4.7, which is really trying to encourage health and wellbeing boards and the broader system to think about neighbourhood health plans in the context of the wider public sector reform, because there's so much change going on at the moment, which we keep talking about, both across adult social care, children's services, and across local government more generally. And we're also at a point, aren't we, in Derby and Derbyshire, but Derby, where there's a range of different developments taking place in our place to really try and help and support communities and to help communities navigate a complex set of systems, I suppose. And the worry, in the most cynical form, is that this is another layer of must-dos from government, that if we don't try and just take the time to think about how it all connects up, that we miss some opportunities, really, in terms of threading things together. And I think one of the strengths we've got in Derby is our system and how we work together in terms of our strategic and operational partnerships. So we just need to, I think, really be practical in how we work together as a system in taking this forward and how we join it up in a way that ultimately will make better sense to families and to people and communities, but also just really try and get the advantage, I suppose, of what we're trying to do here for people, and not try and silo it up in that's health, that's social care, that we've got to really think about it in a very holistic way. So I would just urge us strategically to try and get that thinking time involved in this so that we can then work together to take it forward. And that becomes even more important with the LGR space as well as we go forward too. So if we can just take some time, not now, but just in that thinking time and how we do that, that would be massively helpful. And that's an urge to the ICB, but also to the wider system. Thank you. Thank
you. I've got Claire first and then Sue-Ann. Thank you.
Okay, thank you, Chair, and thanks. Just to build on that, I completely agree. I mean, this, if we view this paper as an NHS plan, we've got that wrong, because that's not what this is. And it's clearly the neighbourhood health framework is designed not to be that. And that's why it's positioned local authorities and ICBs under the Health and Wellbeing Board to lead it, because with the key commissioners of a lot of services. But I think for me, you know, when I was having the discussion last time about us doing a bit of thinking, and maybe it's a development session, I don't know, Chair, if you usually do those, but there's something about public sector reform in its widest sense coming together and having those conversations at probably chief officer and officer level initially. And that's some work I've been involved in another area, which has really helped us all to understand each other's lens, and then where we can really add value for our communities and take this work forward. So that might be something that's worth us considering, and happy to have any conversations offline.
So I think that sounds like a really good idea, Claire. I mean, because just quickly before I bring Sue Ann in, I wasn't sure how we were going to get. I'm sure other people, Robin and Andy, have thought about this, but as you know, and it's understandable that I don't know, but I wasn't quite sure how we were going to get to 2.3 really, and get involved in some of those immediate next steps. So I think that people need to come together, there needs to be development sessions, and it needs to be reflective at the beginning. So I think that's really helpful. Thank you. So,
Thank you, Chair. I mean, I think it's interesting, isn't it, in terms of having this discussion, because I would say in the public sector reform for children's services and families first, the DfE have been really clear around strategic leads from health, local authority and education being part of the governance structure. So we already, within some parts of the reforms, are actively having those strategic discussions. So it's making sure, I suppose, that everything is joined up. And I think the DfE are probably a little bit ahead, maybe in terms of defining what is the expectation. So, for example, in the governance board that it is for Derby, we have a seconded strategic lead from health, which is bringing some of that thinking into influencing how families first develop. We have a strategic lead from schools, and the police as well. Sorry, I forgot the police, because there's a whole raft of public reform in the police. So there is a model emerging, and I suppose I'm just a little bit of caution around there's a kind of this sharing and of information and development over here, and then if we do some more of that, we just need to think about how that works coherently, or else we could all be having workshops and strategic leads feeding into a lot of places. So I'm not. Thank you.
sorry, Sue Ann, are you saying, I haven't quite got that point there, sorry, I'm sure others have, but for my benefit, are you saying that you feel that we're not in the dark as to what model we might be aiming for? You feel there are already good models, and I think what
I'm saying is that when we're saying about how do we take this forward so that neighbourhood health framework isn't in isolation, I'm saying that in parts of the public sector reform, such as Families First, the DfE are already mandating that there are strategic conversations at a higher level than just what's operationally being delivered. So there are some conversations that are happening, but perhaps not. But then, you know, it either needs to feed into this conversation, or we need one conversation, because I'm having conversations in Families First, if you see what I mean. Sorry if I'm confusing you, Chair.
Thank you, Sue Ann. I am still a little confused, but I'm going to allow that to. I'm sure that Andy and others are not confused, but I think I get where you're coming from. I mean, I'm going to bring in Councillor Kerr. I mean, we don't need to endlessly discuss this now, because I could be briefed outside the meeting, but I'm not sure how it's going to be clear that, you know, at what point we would engage as a board with the neighbourhood health plans, how it's going to come to us. I don't know how this is going to work yet. Who's going to set? You know, I know you've already set out some neighbourhood health plans as an ICP. You've already even. Apologies. You know, but I don't know. I don't have a sense yet of how this is going to work, which doesn't mean that other people haven't thought about it. But I think it would be useful if we get some kind of time frame or some sort of understanding. But I think notwithstanding what Anne said, I think we probably do need that development session because there is confusion, certainly on my part. Can I bring, do you want to quickly come in then, Claire, just to respond to that point, and then I'll be...
Yeah, just to say, I think the development session would be really helpful because it pick up exactly the point that's just been made, I think we've got partnerships all over the place, and I mean, I go to that many, I couldn't even begin to describe them all and what they all do, so I think it's just having that development session might give us that opportunity to go, well, how many do we need and what do we need and what's the right shape going forward. So it was just a suggestion really of how we could start to align some of that, which I think is reasonable. It's worked elsewhere in another health and wellbeing board that I'm part of, and it's been very, very helpful, and actually we've been able to streamline some of the other forums as well.
Okay, thank you. I think everybody's sort of asking for that, Claire, so that'd be helpful. Thank you. Councillor Kerr.
Chair, I was also looking at 2.3 and thinking about the next steps, and I think exploration about what the next steps ought to be is probably quite important. But it strikes me, as I sort of said, alluded to earlier, that some of this delivery is going to require buildings to be delivered from. Not all of them, but some of it will require buildings, and that will have land use implications. And therefore, I think that our strategic planners need to be aware of this. So I was going to suggest that we share this document and provide background people for them to talk to about what the implications may be, so that that can be built into local plan work and also into the discussions that planners have with potential developers, so that when they're talking to a developer for another 600 houses or something, they can build in the fact that that area needs this sort of building space so that it can be accommodated, and they design a scheme that would accommodate that, or it can be included as part of a Section 106 planning gain fund or whatever. I'm also mindful that with LGR, this is going to be something where the conversations need to have not just within the city, but with the district and borough authorities nearby. So they might tactfully ask, we might tactfully ask whether the county council is doing this sort of liaison with the districts and boroughs that are currently working with it, or whether we should just give a heads up to the planning authorities nearby so that they are also clued up to this for the future.
Thank you, Councillor Kerr. I suggest that's a point that could be raised at I hope it come to you at the development session or something. I mean, I'm personally I think you raised some really good points, but I'm not sure. I think there will be new buildings, but I think it's also about how the existing estate works better together. I think I'm certainly a bit wary about planning being, I think we need to know what our aims for are initially and then let the planners in. My experience with planning is that you never get what you want, Lucy, but then I'm not a member of the planning. I'm a hapless councillor who turns up and makes demands from the planning committee and often don't get what I want. So did you want to just respond quickly to that, Claire? Because I've got Amjad, yeah.
Yes, sorry. Just to say, I think from a how we'll operate with 106 and all of the other sort of things we do around planning of surgeries, that nothing changes within that. There is some guidance that's come out about neighbourhood health centres, which we are reaching out to colleagues about and with local authorities. I think realistically there's not going to be loads of new buildings. This is about how we work together to support individuals rather than a building frame. So it's probably just worth just stating that. But it's a good point. Thank you.
Yeah, I think absolutely. I think that was my understanding. But I think Councillor Kerr makes a good broader point, especially for the planning committee on which she sits. And are you the vice chair, Lucy?
Currently, yes.
Oh, well, you see. So, well, perhaps you could bring this back to us as well, Lucy, at a point when you think it interacts with it again. Thank you. Amjad.
Thank you. Just from a voluntary sector perspective, it's really positive to see that a clear focus on reducing inequalities and the recognition of them sort of high needs groups. But I think we feel that for this model to truly work, we've got to be utilising them trusted community infrastructure spaces. And what we mean by that, those that sit within that voluntary sector that really serve them what we see as hard to reach or underserved communities. And at the moment, there just seems that the voluntary sector is not really connected in with this whole sort of piece of work. Appreciate it's still early days, so we really welcome that development session that you talk about to get the understanding so we can define roles, and in particular the role of the voluntary sector, because if we're going to be shifting from sort of prevention to treatment, and prevention lies within sort of communities, then the voluntary sector plays an integral role in that.
I agree with that, Amjad. I don't know if anybody, because we had that sort of built into the whole ICP framework, didn't we? And also, and it will be, obviously, goes without saying, built into any future health and wellbeing board framework, and that will be this will be the locale that kind of oversees the neighbourhood health plans, although in a way yet that I'm not quite sure how that's going to work. But does anybody else want to come back to Amjad's point, because I think it's an important one? Claire?
Yeah, just to say it is a really important point, and absolutely we can't do this. This is really ambitious, isn't it? This framework, what's been set out, and actually you have a reach into communities that a lot of statutory sector organisations don't. So it's fundamentally important. So just to echo, I agree with you.
So I'm going to have to start, well, actually we do have time, but I will start just taking the last comments on this. But Councillor Ashby.
Just one very brief comment, you'd be pleased to know. I love the goals in 4.5. I'm just really concerned about the funding to achieve them. You know, who wouldn't ascribe to all of those goals? Improved health outcomes, improved access to general practice, improved experience of planned care, urgent and emergency care, and patient and staff satisfaction is what we absolutely all want. But without adequate funding, I have no idea how any of that can be delivered.
Well, Councillor Ashby is...
I'm not expecting that we have the answer to it. I'm expressing my concern about how it's achieved.
Yes, well, as members of the party governing the country at the moment, I'm sure we can use our great influence to influencing. But I think that is a very fair point. But I still think, you know, in documents, it's good that we've got the right goals. I mean, that's a starting point. I mean, clearly having goals and not achieving them or not being able to realise them in actuality is a bit pointless. But on the other hand, it's good to have the right goals. So I think hopefully we could recognise that. And just anecdotally, I think that improving patient and staff, as a patient or like yourself, you know, somebody who engages a lot on behalf of somebody else with health services at the moment, I think I've seen huge changes even in recent years in terms of people aiming to consider whether patients are satisfied or not. I mean, compared to 20 years ago, say. So, I mean, well, and that's not necessarily all down to funding. So whilst on the one hand, I totally agree with you that we've had an underfunded NHS for a long time, in my opinion. I know that's a political comment, but it's one I would stand by. And there are attempts to try and improve that, but obviously it's slow burner. On the other hand, I think there are things that are happening that do meet some of these goals that are not just funding dependent and are really important. So I don't know if that's a fair comment. You could, yeah, I mean, to give credit to the staff, the changes, you know, have been remarkable in many ways, and attitude in many areas, I think. But anyway, any further comments on this? So my concerns, okay, thank you. If there aren't, I'd say that on the recommendations, we have certainly noted them, 2.1. We have certainly considered the implications in terms of, and also, thank you, especially yourself, Councillor Ashby, talked about resourcing. I'm still not sure how, Robin, can you help me with 2.3? I'm not sure what we're agreeing to there. I mean, I agree to it. I just don't. Do we need to have we set something out? I suppose we're only asked to consider it, aren't we? But do we have agree next steps? I mean, we haven't got any next steps set out to agree, have we?
I think we've agreed that we're going to have a development session. I think that's what we've agreed.
Okay. Yes. And okay, that's a really excellent point. Thank you. So we're all happy to see that as the crucial next step. Yeah. Okay. So we can all accept recommendation 2.1 to 2.3. Right, well, thank you for that. I mean, it's a big new area, it's massive, it's ambitious, it's probably underfunded, as Councillor Ashby said, which is crucial, as everybody working in the NHS and local government knows. At the same time, it's important steps in the right direction. So thank you. Next one then, I'll move on now. Thank you for that, Robin and Alex. Is Robin again, Robin Dewis, on the COVID inquiry update.
Thank you. So we agreed some time ago that each time a module of the COVID inquiry review was published, that we would bring that to the board just for consideration for any implications for us. And there have been 2 published since our last meeting. So we have Module 3, which was the impact of the pandemic on the healthcare systems, and Module 4, which was vaccines and therapeutics. Quite different stories to say about the 2, but if we just consider first some of the key findings from the Module 3 report, there in the paper, was really around the issues around capacity and readiness from a health service perspective, and again highlighting the issue around investment and sufficient staffing and capacity there. So I think that probably echoes some of the recent conversations. There's some key things around infection prevention and control guidance, and to reflect that, if you remember back, Councillor Martin, we were struggling with the guidance, particularly relating to social care settings. And I'm not sure that that has been resolved yet. The infection control guidance tends to be NHS guidance for NHS bodies, and that remains an area of concern for if we do have guidance that we need for social care settings. And that's something that we've been discussing through the pandemic exercising as well. And the data collection issue, so again, we raised that through the pandemic exercise because we're still in a position where we don't have arrangements for easy data sharing at a local level. This particularly relates to individual level data. So we proved last time it's possible to do, and we can put those arrangements in place, but it's not something that we can just get off the shelf and start doing. It needs some prior process and agreement. So I don't think there's anything that we as a board can resolve, but I think it's worth noting that there's some key areas there within Module 3 that that are learning, and we wait to see what the response from the government is towards those. I think Module 4, there's a line which I was just reflecting on in here. Almost 87% of the adult population in England had received at least 1 vaccination dose by July 2021, which I think at the time we were in the middle of that process. We hadn't fully taken that in, but that's incredible that we'd got to that point. And I think that's really of note that actually that was an area of our response that worked incredibly well. But I think we just need to also reflect on the impact of that vaccination programme, because we are now in a position where vaccination rates are generally a little bit stagnant, if not a little bit decreasing. We're struggling with some of those messages around vaccination, some of that misinformation, and also really, really clear around trust with some of our communities as well, and that's absolutely key to in order for us to improve our vaccination uptake. So we do review vaccination in the Health Protection Board, and we do report on that. And just to note that, as I've mentioned before, the responsibility for commissioning vaccination and screening services will be transferring to the ICB from April next year. And I am linked into some of that work regionally around how NHS England are transferring that function safely and how those new arrangements will work. And I'm sure once we get to some clarity around that, we can update the board on those arrangements as well. So very happy to have any comments or questions on that.
Oh, thank you, Robin. Any comments or questions on this one? I would just quickly say then, Robin, thank you for reporting. I mean, it's a little bit overwhelming, some of this, isn't it? And I suppose at the end of the process, you'll bring us a report with all the recommendations and perhaps maybe highlighting where we need to take action. I suppose it's just, it really is a huge body of work, isn't it? And thank you for bringing it to our attention. And I would totally concur with that view about the vaccination process, because I remember going to Midland House with someone who was very late to the party because of their own health issues in relation to getting a vaccine. And because of those own health issues, wanted one particular vaccine rather than the other, a make-of, which I know was not really on offer and wasn't viewed as critical. But in that moment, they had somebody standing there who they could give a vaccine to who'd not had one. And it was like, it was really like the spirit of the NHS, I think, and our public health service, and you know, really being enacted, because they weren't going to, they could be really awkward, or they could say, okay, well, this, I can't remember, you know, we're currently using this batch of vaccines, but we've got some of the others in the fridge or whatever it was, you know, we can go and get one of the others, and we can give this person the vaccine they want, so when they leave this building, they've been vaccinated, and we've achieved what we absolutely must want to do. And that's exactly what they did. And that flexibility and that absolute focus in the moment on what the real outcome was, rather than, no, sorry, dearie, you know, you're not going to get what you want because why would we do that? You know, it was amazing. It was amazing to see. So it was a massive achievement, and lots of really amazing things were achieved during that time, weren't they, really? Although it was just a horrible time. And the longer it goes on, for me personally, I just look back and see it with more and more horror, although I kind of got through it like a lot of other people, okay, at the time. You think, I don't think I could do that again. But so it was amazing, and that vaccination program was really, well, I say the NHS, I mean, it was, were we overseeing it? I don't know. It was the health system.
The NHS were delivering the programme, but we were working in partnership, weren't we, around around where it was delivered and how we were promoting. And Amjad, absolutely key in that as well, weren't you?
Well, there you go, an integrated process with all partners working together to achieve the outcome.
Yeah, just to come in on that, I think just one of the recommendations in terms of targeted vaccination campaigns, we've just completed our wave 3 of vaccination engagement work with the community, in particular communities where trust is a big issue. The report's just about to be published, and that's funded by the ICB in partnership with Public Health. A lot of learning that's coming out, and I think the main thing that's coming out is that building trust, especially if we're going to look at it, we build trust in one area, it's not as simple as, it's quite multidimensional, and this is where it's important that we've got to start looking at things holistically. You can do amazing work in one area to build trust and confidence with vaccinations, but you have another bad experience with the system somewhere else. It just hinders and knocks that back so much.
No, absolutely, Amjad. And whilst, you know, having a strategy document is just a strategy document, at least we have, I think we have captured that. I feel that both the poverty strategy and the Health and Wellbeing Board strategy, it doesn't say that specifically, but all the actions in there capture that, the spirit of that, that kind of way of working. Thank you. Thank you, Robin. So it's Robin again to give. We do have a few minutes, Robin. Did you want to speak to the Health Protection Board update just for information?
I can just mention some of the key points. We don't often get to talk about it, do we? So the last meeting was on the 20th of March. We always have the Health and Wellbeing Board just shortly before the next meeting. So we're meeting again in a couple of weeks. So the paper just runs through some of the key areas that we discussed last time. And as you're aware, the Health Protection Board is a joint city and county board that reports to both of the Health and Wellbeing Boards. So infection prevention and control is one of the standing items on our agenda. And we discussed a project that's currently been running in the county to improve knowledge and skills in care settings. And we've had a very similar project that has run in the city with care settings that was managed to be funded through the COVID funds. And as previously mentioned, we do have a gap in the service around community IPC provision. That isn't resolved as yet, but we are now having conversations and progressing those conversations with cluster ICB colleagues. We are utilising the Health Protection Assurance Framework, which is locally developed but nationally recognised framework for ensuring that the Directors of Public Health are fully assured around health protection arrangements. It's got several sections to it, but the particular section on communicable disease we've previously assessed ourselves against, and we were able to review, and the board were fully assured around progress against all of the actions within that. Within immunisation and screening, it won't be a surprise that we discussed the meningitis outbreak in Kent and the subsequent local vaccination provision. And at the time, we weren't expecting any local actions to be required, and there weren't any local actions to be required, but we were assured that all of the plans were in place if a local response was needed. And we also discussed the challenges around school-aged immunisation. We have deteriorating uptake, I would say, within our school-aged immunisation, and that remains a challenge. And as with those regional conversations that I've been having around the transfer of responsibility, I'm also involved in some regional conversations around how we can improve the school-aged immunisation uptake, and there is currently a national review into that programme that I'm inputting into as well. So hopefully we'll be able to improve that. The Local Health Resilience Partnership, there's currently a review within the ICB around the arrangements for local health resilience partnerships. It's part of our local responses, but also is integral to the ICB cluster. So consideration as to how that will work in the future is ongoing. We reviewed TB and the regional programme of work, and I have mentioned previously to you around the increasing rates of TB nationally and the focus of the NHS regionally around how we can work together to reduce TB prevalence in the community. And finally, we reviewed local national increases in measles cases. Apologies, not local. So there has been a national increase in measles cases. We've seen, particularly around London and the West Midlands, we've seen increases, and we're working together with the ICB to look at how we can improve the uptake in measles vaccinations. You might be aware that there's been a change to the schedule now, so that the second dose has been brought forward. Previously, it was at 3 years, 4 months, and it's been brought forward to 18 months, and the hope is that that will improve the uptake of that second dose as well. Very happy to have any questions on that.
Thank you. Councillor Ashby.
Just a comment, not a question. Thank you very much for the update. It's good to see all the work that's going on. I would have thought if one good thing can come from social care and the NHS working closer together, it would be infection prevention and control in the care setting. So I really hope that that issue is nailed down once and for all for eternity going forward, that even though it's a fixed term piece of work, it just needs to be done and sorted, because it's a huge scar really on the care of people in these settings. So thank you that it's been done.
Any other comments? Thank you. Thank you very much, Robin, for that. There's so much information in this, but thank you. Alison, the forward plan.
Thank you, Chair. Just very briefly, so we've got an outline agenda for the next meeting in July, and just to note that I think that's a provisional date still, isn't it? So that should be confirmed within the next few weeks. You'll see we've got quite a few items to schedule over the coming meetings, and I've got obviously the notes today for a couple of other items to add to the future agenda. And also I did kind of reflect, I think we've mentioned kind of the work around development as a marketplace, but we haven't actually, I think, come and talked about that in detail, so I think that's another item that we do probably need to add on to the forward plan. But as ever, if there are any other items, you just let me and Nins know and we'll add to the forward plan.
Thank you. Yeah, we're not sort of actively seeking items. We're developing a backlog to manage to match some of those known in adult social care and often developing in the NHS as well these days, or whichever way around that goes. No, seriously. We'll have to look at it, and maybe we could have shorter items and say less or something, but it sometimes seems a bit pointless. If you bring an item and we can't discuss it, it seems, well, we could just publish it as something for people to read, you know. So we'll have to think about it, because we are developing a backlog, aren't we, in the classic tradition of health and social care service.
Yeah, and I think one of the other things, I know we've obviously had a brief discussion today about kind of neighbourhood health and the development session, but there's also kind of scheduling actually how we programme the work and discussions to move that forward over the next year too.
Okay, thank you, Alison. Well, I think unless there are any compelling last moment comments, I'll draw the voting to a close. Thank you for coming this afternoon, and all being well, we'll see you all in July. Thank you.